Good afternoon, everyone. Hi. So I just want to thank everybody for coming. My name is Marisol Cruz. I'm the operation manager for Harrington Hospital with UMass Memorial Health. So we do all of the community education events as well as outreach and inclusion events. So today, super excited because we have Kellyn Slow. She is our DPT with our rehab department. And her presentation today on healthy and happier bladder is a really great presentation that I think you guys are going to enjoy and find really informative. So I will let her take it over, and then you guys can ask questions at the end.
Thank you. All right, so I am a physical therapist at UMass. I work down the street in Charlton at their location, and then I also work in Webster. And so what my job is to be the pelvic floor physical therapist. And so everything involving the pelvic floor, don't worry, urinary incontinence, pelvic pain, bowel dysfunction, back pain, things like that is really what I come into play. So what I'm going to talk about today is not every single thing you'd ever need to know, but really just the details that you can walk away with and learn from and start implementing into your life if you feel like maybe they'd be a fit for you. So things that we're going to go over is what the pelvic floor is, what is pelvic floor PT, what to expect, all of those habits that you can help limit or include into your life to make your bowel and bladders a little bit happier, and then some exercise options, and then some times for questions. So like I said, I'm a physical therapist. I got into pelvic floor as soon as I graduated college, as soon as I graduated PT school. I've been doing it ever since. It really is my bread and butter, and I love it, and it makes me happy to help people feel better about their life and just feel more confident in things that they can do without having leakage or pain or difficulty. And so the pelvic floor is a bunch of muscles. So there's 3 layers. If you think about our pelvis, we have our left and our right pelvic bone, and then within the pelvis is something called a pelvic outlet. This is a big hole that those bones joining together create. And then everything you see in red are the pelvic floor muscles. So their job is to come underneath and support everything within the abdomen. So it is truly the floor of your abdomen. Everything in there is supported by those muscles. And then through your pelvic floor muscles, you have your urethra where you pee from. If you're female, you have the vagina. And then regardless, you have the rectum. And so throughout those muscles run those 3 systems. So any problems with those muscles can create dysfunction within those systems. So with pelvic floor PT, I am looking at your hips and your back and your strength, your flexibility, how your joints move, everything around the pelvic floor as well as the pelvic floor itself. Those muscles are just like any other muscle within the body. So they can have pain, they can have trigger points, they can have tightness, they can be weak, they can be discoordinated. And so we're trying to help get them to be a little bit more functional and improve their role within the body. The other important thing with the pelvic floor is that it creates this bottom of the pelvis, which plays a role into how we breathe and how we manage pressure. So something like back pain, which isn't the pelvic floor, can be affected by the pelvic floor. And so when we bend over and we generate something called intra-abdominal pressure, which is all the pressure in our belly, are we sending it all into the back? Are we sending it into the pelvic floor? Are we managing all that pressure correctly? Because if we're not, what's going to happen? Are we going to cause a problem within the pelvic floor? Are we going to cause worsening back pain? Are we going to cause an abdominal hernia? So everything is super connected to these little muscles, a small group of muscles. And so these muscles, just like any other muscle, have to be able to lengthen and contract. So sometimes people will talk about something called a Kegel, which is a pelvic floor contraction, and it has been used as like a one-all treatment for people for a really long time, but it's not very appropriate for most people. So first and foremost, Kegels are a pelvic floor contraction. If you came to me and said, hey, I have elbow pain, and all I had you do is this all day long, you'd think I was crazy. You need to look at much more with the muscles than just the ability to contract. So your doctors might have said, oh, you're having trouble with your leakage? Start just doing your contractions, start doing Kegels. The problem with that is it doesn't actually figure out what's going on with your muscles. So if your pelvic floor muscles are really, really tight and all you do is contract them, you're not gonna fix the problem. It's like taking a trampoline that's frozen and jumping on it. It doesn't have any give to it, it's gotta have some flexibility. So first and foremost, every single person needs to understand how to lengthen their pelvic floor muscles, how to relax them. And then once you're able to relax them, then you can start working on the contraction strength. So first and foremost, if doctors have told you to just do your Kegels, and I hear it all the time, but I do my Kegels, I should be fine, there's probably a chance that something else is going on. So hold off on Kegels until a pelvic floor PT looks at you and tells you that it's something that you should be doing. If you have a pelvic floor physical therapy appointment, things that you can expect is, like I said earlier, looking at your back, your hips, your flexibility, your strength, how you breathe. I teach a lot of people how to breathe, which they think is crazy. They never thought breathing could be so difficult, but it is. It takes a lot of practice. And what the importance of breathing is that every time you inhale, what should be happening is your whole abdomen should be filling up with air. A lot of times, women especially, we wear tight pants, we don't let our belly we don't want our belly to come out a little bit, and we end up just doing all this chest breathing. When you do all your chest breathing, you're never letting your belly expand, and when that happens, you're getting a passive stretch to your pelvic floor. So every time you breathe, you get a little bit of that lengthening, a little bit of that relaxing. Breathing can be very helpful as you do activities because it helps you manage pressure. So looking at, can I exhale as I go to pick my groceries up so that way I don't cause a lot of tightness in my back? Can I breathe while I'm trying to have a bowel movement so that my pelvic floor muscles relax? So it seems very simple. We all know how to breathe, but do we all know how to breathe very effectively? The answer is probably no. And so with pelvic floor, we're going to do everything around the pelvic floor, and then we actually look at those pelvic floor muscles. So this is where a regular PT appointment looks a lot different than a pelvic floor PT visit. So it's always up to you. It's never mandatory, but it's very helpful. We do an internal vaginal exam if that's where the problems are, if they're related to the vagina, or if they're more related to bowel movements, rectal pain, tailbone pain, then a rectal exam might be something that we look into. The ability to do an internal exam allows me, or another pelvic floor PT, to really figure out what these muscles are doing. So like I said earlier, these muscles can have pain and tightness and trigger points like a muscle in your leg or your back. So we can actually look at these muscles and feel these muscles and work on them, massaging, relaxing, releasing the trigger points there. And then by having one finger inserted into the vagina or the rectum and you do a pelvic floor contraction and a lengthen, you can actually understand what those muscles do when you tell them to do that. Can they lengthen? Are they really tense? Do they have the ability to coordinate? Do you have literally no idea how to move those muscles? And so then based on everything we find, then that's what we do with our treatment. So that's just some expectations about what to expect if it was something that you were interested in. And then of course, depending on what the symptoms are, determines how long we work together, what your treatment looks like, what your homework looks like. But regardless, everybody has a pelvic floor. Chances are everybody could use pelvic floor PT. So things that are very commonly treated with pelvic floor PT. Urinary incontinence, which is leaking. There's a couple different types of urinary leakage. Something called stress urinary incontinence, which is I leak when I cough, sneeze, laugh, jump, lift. Then there's something called urge urinary incontinence. That is, this urgency to go to the bathroom comes on so fast and so strong, and I can't make it to the bathroom in time, and I leak. No matter what, I feel like I'm peeing all the time, and I'm always trying to know where a bathroom is, and I can't go for long drives. Then you have something called mixed urinary incontinence, which is I have a little bit of both. I have kind of the coughing, not necessarily everything else, and then I definitely have some of the urgency. And then there's something called functional urinary incontinence. That is where something within your body, say trouble with vision and it's nighttime, or difficulty with your balance, or difficulty getting your pants unbuttoned to make it to the bathroom, something outside of your pelvic floor limits your ability to make it to the bathroom in time. And so that, if that is something that you're looking at, it might not be as much of the pelvic floor exercises as it is working on whatever is limiting your ability to make it to the bathroom. Other things is urinary frequency. So do you feel like you run to the bathroom all the time? You can't leave a store without stopping at the bathroom. You have to run as soon as you get home. Feeling like you're always needing to know where a bathroom is. Pelvic pain is another big one. So pelvic pain can be within the pelvic bones, it can be hip pain, it can be back pain, it can be tailbone pain, or it can be pain with sexual intercourse. And so first and foremost, pain with intercourse is never normal, should never be a thing, should not be happening, there should be no pain whatsoever. And then we have things like constipation. So a lot of times constipation is usually due, or can be due to dehydration, difficulty with our diet, or other things outside of the pelvic floor. but the pelvic floor can play a role in constipation. Because if you are very tight within your pelvic floor muscles and you don't really know how to relax them, then you're gonna have to try to push a bowel movement through a very, very small hole that does not want you to have a bowel movement. And so then we've got to relax these muscles and teach you actually how to have a proper bowel movement, as well as other things, sitting on the toilet correctly, breathing, some other lengthening, relaxing techniques. Like I said, we can have bowel pain or back pain, abdominal pain, hip pain, that yes, might be due to something within those areas, but it also might be pelvic floor pain. Part of our pelvic floor muscles, specifically 3 of them, and it's these deeper ones in the back, are actually hip rotator muscles. So hip pain might be coming from the hip muscles, but it might be due to something a little bit more internally. So maybe a trigger point within the pelvic floor muscles versus just within your butt. And so if you've had hip pain that PT doesn't really work for you, or the surgeons don't really see anything, or the orthopedics don't find anything, then having a pelvic floor PT look at those muscles from the inside might be something that's really helpful. Back pain and abdominal pain, they have no physical, overlapping of the muscles, but they're very, very close to one another. So your back muscles come all the way down your spine and attach on the end of your spine, which is also where your pelvic floor muscles attach. So they're very close in proximity. Hip muscles that are not within the pelvic floor also are very connected. Your abdominal muscles all come and attach on the front of your pelvic bone. And so if there's tightness in one of those areas, you can have referred pain into the pelvic floor, and then vice versa. There's also something called fascia. So if you think about a chicken and you peel the skin off a chicken and there's this white webbing, that's fascia. We have fascia throughout our entire body. It's one continuous sheet. If you think about the structure, you've got skin, fascia, muscles. If you think about that fascia then your abdominal fascia is very connected to your pelvic floor, back, hip fascia to your pelvic floor, so everything is very connected. I'm also a lot of times massaging people's bellies, and they'll say, I've never had my belly massaged, but man, does this feel good, because we just hold so much tightness in here, we don't breathe into our belly, we don't overstretch our belly, and so that in of itself can play a big role, regardless of the pelvic floor. Maybe there's some abdominal tension that's playing a role into your back pain. And so PTs can treat back pain all day long. I, as a pelvic floor PT, just have a little bit of a perspective on those kinds of things that maybe a regular PT doesn't see. So, long story short, everybody can benefit from pelvic floor PT. So, like I said earlier, things to expect is a regular PT exam, so flexibility, strength, how you move, how you walk, how you breathe, and then that internal pelvic floor exam if it's something that you would think is helpful, if that I think is helpful, and that if we agree to it, or if you agree to it, and then based on what we find, it really determines our treatment. And so let's get into bladder habits. So we all pee. We all should be drinking water. We all should be peeing very happily. We should not have had difficulty, but that's not always the case. So some things that you might be doing that is not making your bladder pretty happy. So number 1, peeing in the shower. If you pee once in a great moon in the shower, it is not a problem. If you pee in the shower every single time you take a shower, that's when it becomes a problem. The reason that is because your brain will start associating the shower with going to the bathroom. And so then this little innocent act becomes a big problem, because now you can't hear running water without going to the bathroom. So now every time you wash the dishes, now you're going pee. And so it's not that there's an actual problem, it's just that your brain has created this pathway to say, hey, running water means we go to the bathroom. So then what happens if that's something that you deal with and you're always running when you hear running water, we have to start training your brain to say, hey, just because there's running water does not mean I have to go to the bathroom. So then you use something called urge control techniques, which is I will go over, to then retrain your bladder. Another thing, just in case peeing, same exact concept. That is when you go to the bathroom, just in case. So I'm gonna go leave the house and go for a car ride. I'm gonna go to the bathroom just in case I have to go pee. I'm gonna be in the car for 3 hours, I'm gonna go pee because I bet you I can't make it. Or I'm at the store, I'm gonna leave before I go home, I'm gonna pee so that way I don't have to stop. It sounds innocent, but again, if that becomes a very commonly thing for you, then that is going to create another pathway. I was in Walmart the other day and I went to the bathroom And this woman was like, why is it every time you go into Walmart you have to pee? And I was like, lady, you have no idea who you're talking to. I was like, here's a business card, that's not normal. But that whole idea of like, well, she has now created this pathway within her brain that thinks she has to pee. And so that will lead you to go to the bathroom more often and more often. Because, to keep numbers simple, your bladder fills up little by little throughout the day as you drink fluids. So let's say it's 25% filled, you barely even know that you have to go to the bathroom, you don't even really register it. You continue about your day, it fills up 50%, and you're like, yeah, you know, she should be done in an hour and a half, like I'll be fine, I'll just go in before I leave, because I'll actually have to go. And then 75% filled, and you're like, all right, she's gotta wrap it up in a couple minutes, I'm gonna need to go to the bathroom. And then 90%, you're like, I'm gonna pee my pants if I don't go right now, so I'm gonna run. If you start going just in case, or in the shower, or you know, other little habits at the store, your brain is gonna start saying, huh, so she goes when I don't tell her, so that means my signals must be incorrect, so let me rework these. So now your bladder's ability to fill lessens and lessens and lessens, so now you feel like you have to run to the bathroom because you're gonna pee your pants, and then you go and it's only a couple of dribbles, and you're like, that was it? It's just because now you've made these pathways that your brain thinks it has to go more frequently. With that comes the idea of, I'm gonna stop drinking water, because if I don't drink water, I won't have to pee. Not the case. You will always create urine. That is what your body does. The less you drink, the more acidic your urine is. Really acidic urine irritates your bladder. So you still have to go to the bathroom. If anything, you actually have to go more. So just because you stop drinking water doesn't mean your problem's fixed. You have to practice those urge control techniques and challenge yourself to say, I don't have to go to the bathroom. You know, I have people who come in, they pee before they leave the house, they pee when they get there, they pee at the end of our appointment, and then they tell me they're gonna pee when they get home. You need to pee every 2 to 4 hours. That's normal. Common, yeah, it's very tough to believe, but it is.
Fall into all your categories.
Yes, like sign me up, check, check, check. So 2 to 4 hours is normal. So within that hour, this woman has now gone 4 times. Your brain is gonna start to really think that you have to go that much. And it's gonna be this vicious cycle where it just lessens and lessens and you're having to go way more frequently. Opposite is holding your pee all day. So this is very common with waitresses, teachers, nurses, people who don't have access to the bathroom. The problem with that is that your bladder, again, you will continue to make urine, even if you don't drink any water. So your bladder is going to overstretch and overfill, and it's a muscle. So when you overstretch that muscle, it lacks what we call tone, and it doesn't really contract very well. So then you have difficulty fully emptying. You have difficulty even going to the bathroom. And then sometimes you'll have leakage just because it's so filled up that no matter what you do, it can't hold in all that urine, and then you have some leakage there. So always, again, 2 to 4 hours. Some people fall really close to that 2 hours. Some people fall really close to the 4 hours. But regardless, going more or less is not the best. We want to be relatively close to that window. There are people too where I get them from going every half an hour to every hour and a half. And then they're not at that perfect 2 hour window, but it's way better than what they were before. So I'm talking about these textbook perfect, you know, ranges and frequencies, but if it's better than what it was, then that's good. I'm okay with that. Another one, Kegling while you pee. I've heard this from doctors a lot too. They tell patients who have urinary problems, well, just practice your contractions while you go pee. Worst possible advice. I don't know why it still exists. It messes with your bladder significantly. Don't ever do it. So the reason that is because when you pee, your bladder is contracting to push the urine out, and your pelvic floor muscles are relaxing to let the urine out. They both really don't contract at the same time. So if you're trying to contract your pelvic floor, well, your bladder is going to say, oh, that means I have to stop contracting. It's going to stop contracting, and then you're going to have this difficulty emptying now, because again, you've created this pattern where your body doesn't really understand to relax when you go pee. So don't practice your contractions while you pee. Again, if a doctor says that, be like, you should go talk to Kellyn, because I bet you that's not accurate. And then not drinking enough or drinking too much fluid. Again, something that I hear all the time, well, I stopped drinking fluid because I don't want to go pee. It is appropriate to stop drinking, 2 to 3 hours before you go to bed if you struggle with nighttime peeing, that's an okay adjustment. But generally as saying, oh, I don't drink because I don't want to pee throughout the day, not as good. We're still going to have difficulty. We want to fix the problem instead of just trying to avoid it. When you are drinking fluid, it should be half of your body weight in ounces. That's how much water you should be drinking. I always will say, you know, I drink coffee in the morning. I'm not going when I start to get worried is when people come in to me and say, oh, I drink a thing of coffee and I drink 1 water bottle. Like, that's the problem. If you drink a pretty good amount of water and you have a coffee or two, that's okay. So I always say, you know, generally try to get at least 75% of what that number is to be water. And the rest of it can be some things that are not water. The reason that I don't like when people's majority of their fluid intake is coffee is because coffee is a bladder irritant. Other bladder irritants, seltzer water, soda, tea, juice, and coffee. So if your diet or your fluid intake consists of all of these fluid irritants, well then is your urinary urgency and your leakage due to what you're drinking or due to another problem? There's a lot of times when all I have to do is tell someone to stop drinking something and their symptoms go away. There's also people who are very sensitive to bladder irritants, like an artificial flavor. I have one patient who no matter what, she cannot have artificial fruit flavor in her drinks. It throws her for a loop, she leaks like crazy. So all we had to do was just take that out of her fluid and she was fine. She stopped leaking pretty much instantly. And so if you're gonna drink fluids, aim for most of it to be water, and then if you have 1 or 2 cups of a bladder irritant, it's probably not that big of a deal. But if you want to test it and say, hey, what happens if I completely remove those for a day or two, see how your symptoms do, and then you can kind of figure it out from there. And then lastly, running to the bathroom as soon as you have the urge to go. So again, that contributes to that urinary urgency and the frequency, and so working on some urgency control techniques to help with that. So healthy bladder reminders, like I said, you should be going about every 2 to 4 hours. I have it written here 6 to 7 times a day. Go for more than 2 to 4 hours, that's a better marker for you. And then nighttime peeing. So over the age of 60, you're allowed 1 time in the middle of the night to go pee. Any more than that is not necessarily allowed. If you are someone, you're like, check again, add that to the list. So if you're going way more than that, we want to start figuring out why that is. You can be drinking a lot of fluid before you go to bed, and then that in of itself might make you go to the bathroom. Maybe you have a tea every night before you go to bed. Maybe that's making your problem. If you find yourself waking up every morning at 2 a.m., chances are you developed a habit, and your brain now has that pathway to say, oh, it's 2 a.m., we go to the bathroom. And so again, those urge control techniques come in to try to see if you can get that habit to be broken, and then for you to sleep a little bit through the night. If you sleep for a long period of time, well then maybe we're getting up 2 hours before we go to bed, or before we wake up, because we're just sleeping too long. So there's a couple little things to adjust there, but generally, it should be 1 time a night. That's the standard. An ideal pee, this one depends, you know, textbooks say 6 to 10 seconds. The difficulty with that is that your urine stream might be really slow, it might start and stop, it might be, you know, really powerful and strong. There's no dictation as to say, okay, this many fluid ounces gets released in 6 to 10 seconds. When you see me, or if you see me, I do something called a bladder diary. I actually have you measure how much you pee, and then that gives me a way better sense, because how much you take in should relatively be as much as you put out. And then leaking is never normal, and then you should never have difficulty with peeing, so you should never feel like you have to sit there for a while in order for your stream to start. It shouldn't start and stop. It shouldn't veer to one side. You should always feel like you empty. It shouldn't be that you stand up and take 2 steps and either leak, or I'm like, oh, I have to go back to the bathroom, apparently I didn't finish. You can, if you feel like that's something that happens to you, when you finish peeing the first time, sit there for a second, do a couple of the belly breaths, which is on the handout up here that you'll get with the exercises. So do some belly breaths that will help relax the pelvic floor. You can do a little shimmy, kind of shake your hips, rock side to side. You can even stand up, do a little shimmy and sit down, and that should help kind of reposition, get anything out, and relax the pelvic floor to help you fully empty. So that is something you can try pretty immediately. Questions about bladder things? I know there's a lot. Yes?
How do you get an appointment with you? Do you have to be referred by a doctor?
So you do, but you can just call your PCP
Yeah.
even and say, hey, I have some interest in pelvic floor. Can you just send over a referral to the UMass location? And then the department calls
It's
you
on
and
Charlton
schedule
Road.
it. Yep, exactly.
I've seen you there before, for
Yep.
some other things.
Exactly. All right, and then if any questions come up, I'll ask at the end too. Or pull me to the side at the end too. Okay, so next, bowel habits. So bowel, bladder, sexual function, those are the three big things that regard the pelvic floor. So for bowels, not drinking enough water. Constipation is a big thing as people get older. We don't drink as much water, we don't move as much. This is why in the hospital, they make you go with PT and walk immediately as often as you can, because we've got to get things moving. If we sit there, our bowels aren't stimulated that much, and it leads to constipation. So are you drinking enough water? If you're not, that will dehydrate your stool and make you more constipated. And then are you getting movement? Are you getting walks throughout the day? Are you doing exercises? Are you doing things that will help stimulate your bowels? Straining and holding your breath. A lot of people will push to have a bowel movement. They'll strain, they'll hold their breath, they'll try so hard. When you do that, what's actually happening is you're contracting your pelvic floor. So now you're again pushing a bowel movement through a really tight pelvic floor, which is not what you want. That's where things like hemorrhoids come into play. You're pushing too much and straining and causing a pressure problem. So don't strain. If you are having to strain, then looking at taking something like a magnesium supplement or some stool softeners, if it's something significant where you need that help, that's better than sitting on the toilet and straining. The other thing is you really shouldn't sit on the toilet until you're ready to have a bowel movement, until you have that urge to have a bowel movement. If you sit on the toilet for too long, your pelvic floor will start to contract, because again, there is nothing underneath it, and it's holding up everything within your abdomen. So it's got to contract at some point. It's got to support the abdomen. So sitting there for too long becomes counterproductive, because your muscles will just get tighter and tighter. The other thing is when we contract our toes, when we squeeze our toes, our pelvic floor contracts.
Really?
Yes. That comes into play with urge control techniques. So when you're sitting on the toilet, if you're up on your toes, nowadays we have really high toilets most places. If you're up on your toes, well, you're contracting your pelvic floor. You're placing more tension in those muscles, and that can be a thing that will help, or that will make bowel movements harder. So first and foremost, get your feet on the floor, and then in some cultures, they actually will have a bowel movement in like a deep squat position. The reason that is because there's a muscle that goes around the rectum. When your knees are below your hips, that muscle contracts, tightens, and pinches off the rectum. So when you get your knees above your hips, that angle opens and you have less of a kinking of that rectum, which can make bowel movements easier. So there's something called the squatty potty, which is like an actual created thing, which is brilliant. And it's just a stool that you can put your feet up onto. You can also take, if you're out in a hotel and you've got to just take the trash can, you can take the trash can and turn it on its side. You can people have kind of some stacked books, you can take some stacked books, or just get a regular old stool that will also work. That will allow your hips to be below your knees, which then makes that angle a little bit less, makes you have a bowel movement a little bit easier. If you don't have a stool or something to throw your feet onto, you can always just take your body and lean your forearms and your elbows onto your legs. And that will kind of give you a little bit of that angle. But again, don't go onto your feet, on your toes, to get your knees higher. And then a diet full of processed foods. Of course, carbs and processed foods bulk up your stool. So I am not a dietitian, but I can give a little bit of information with your diet to say, hey, are you getting some greens, or is everything pretty much bulking up your stool? Can we adjust any of that for you too? And then sitting posture on the toilet, like I said, feet flat on the floor, knees above your hips. The angle of your body depends on, some people like to be leaned back, some people like to lean forward. Either is okay, whatever feels more comfortable for you. And then just to recap, don't sit on the toilet if you don't have the urge. If you're sitting and it's not going within a couple minutes, get up, move, shake, shimmy, come back later. So things that are good for your bowel. So our bowel should be soft and smooth. It shouldn't be like deer pellets that people talk about. It shouldn't be so watery. So depending on what is going on with the consistency of your stool can kind of give us some tidbits on what to do. If you have really loose stool, like diarrhea, your body wants to get that out. No matter what you do, it's gonna have this urgency and this difficulty to make it to the bathroom. So we wanna work on some urge control, but also trying to bulk up that stool, and then vice versa. If that stool is really, really hard and dry and pebbly, well then are we allowing it to come out, you know, are our muscles helping it, or is it really just the stool that's making it a problem? Pooping should never be painful, it shouldn't be difficult, you shouldn't be straining. So having that good posture while on the toilet. And then after bowel movement, you should feel fully emptied. The normal frequency for a bowel change is different person to person. The allowed normal is kind of 3 times a day to 3 times a week. You can still be constipated within that realm, so you know, just because you have a bowel movement every day doesn't mean you're not constipated. You can still be constipated. So that kind of depends person to person. And then, you know, but ideally they should be happening pretty regular, your baseline, they should be pretty frequent. You shouldn't feel like you're constipated, you shouldn't feel like you have to strain, and you should feel like you fully empty every time you have a bowel movement. There is something called the I Love You massage. This is a very simple thing for you to do if you're someone who struggles with constipation. So you actually massage out your intestinal tract to help get stool to move along. And so you start in the upper left corner, and you just do this laying down. So upper left corner, and then you go right down to a diagonal toward the underneath of your belly button, and you do that like 8 to 10 times. You can even do some circles, and then that's the I, and then the L comes into play because you're going top right, over, and then down the same path that you just did, 8 to 10 times. And then the U comes into play because now you're going from the bottom, up, over, and down. So you're drawing a U, and that will help kind of trace the intestinal tract and help to get things moving if you feel like things are kind of stuck. It also is really helpful for bloating as well. So that's in there if you need it. And then urge control techniques. So these come into play. These work both also for your stool and for your bowel movements. So urge control techniques, that is when you are needing to get to the bathroom and you just need an extra minute to get there. You need to just kind of wrap up something, or if you're trying to work on the frequency and the urgency, or if you're in the car and you're almost home. We don't ever want to rush to the bathroom because when we panic, the leakage is worse and the urgency is worse. So we want to stop what we're doing. We're going to take a break. We're going to stand. We're going to sit. We're going to practice some of our belly breaths, again, that are in the handout. We're going to do what we think is some pelvic floor contractions or a Kegel, because again, if we contract the pelvic floor, we can shut off the bladder from contracting. We can help make those contractions stronger by adding our toes and scrunching our toes. And then we're going to try to distract our brain. So if we're trying to make it to the bathroom or trying to push off the urge, we've got to distract our brain, because our brain is very, very powerful and it's telling you we've got to go, we've got to go. And you will say, no, I don't have to go. I'm good. I can make it. Like I'm in control. I'm not going to leak. I'm not going to pee my pants. I will make it. And then try to identify things in the room or make a grocery list or do something to distract your brain, and you'll notice that urgency lessens so that you can either walk to the bathroom or it goes away for X amount of minutes and allows you to push off that frequency, so then you're getting closer to that 2 to 4 hours. This is really helpful if you're in the car, if you're not next to a bathroom, or again if you're trying to work on that frequency. So with pelvic floor exercises, like I had said before, the first thing you want to do is start lengthening those muscles. So they overlap with your hips, your back, and your abdomen, so getting stretches for those. So things that stretch your hips, things that stretch your back. You can do them in bed. You can do them in bed.
I'm just laughing at laying on the floor. I don't think there's anybody in here that can
Yes,
lay on
no,
the floor.
you can do them right in bed. Yep. So all that, and these are, some common exercises that I do. There's tons of them that you can do. Standing, sitting, laying down. These are just a couple pictures. So the idea is that you're getting your hips to stretch, you're stretching your back, and you're breathing while you do these. So that way you're working on linking those hips, the pelvic floor muscles, the back muscles, things like that. Then once you start to have a good understanding of the lengthening, and then if we had done an internal exam and we determined that you don't do very well at lengthening, we're also going to have you actually try to lengthen. Just like you would do a contraction, I'm going to try to have you lengthen those muscles. So we're targeting the relaxation from a couple different directions. Once I feel like you've got a good understanding of how to do that and how to relax, then we move on to some strengthening. So we're gonna strengthen up through the hips, through the back, through your core. I'll have you do a pelvic floor contraction every once in a while, but the exercises is not to just sit there and do 3 sets of 10 Kegels, because it's not very functional. It doesn't correlate to what you do in your life. So we add them to things, getting out of a chair, getting out of bed, walking, standing, things like that. And then there's different exercises you can do with the strengthening. So there's muscle fibers within your pelvic floor that are for endurance, so needing to hold it in order to make it to the bathroom and contract and hold for longer periods of time. And then there's muscle fibers that are really quick, and so those come into play when you're gonna sneeze, and those muscles need to contract really fast to prevent you from leaking. So on top of just doing a contraction, there's other exercises like, can you do a contraction and hold it for 10 seconds? Can you do 10 contractions really fast? And making sure that you relax in between each. So there's other types of things with endurance. And so with your pelvic floor muscles, there's 2 movements. There's the contraction and the lengthen. If you think about your elbow, and your bicep is this big muscle here. When you contract your bicep, it goes up, and when you lengthen your bicep, it goes out. So your pelvic floor muscles can contract up, or they can lengthen down. I will talk a lot about an elevator analogy. So if you think about an elevator at the ground floor, that's its normal resting tone. If you weren't doing anything, it's just hanging out there. If you inhale, those muscles should lengthen down, which would be like taking that elevator to the basement. And then you would contract them up on your exhale, which would be taking them past that ground floor up to, say, the 3rd floor. So every time you do a contraction and a lengthen, you're always going past that resting state. That's really important because that goes back to the idea that people don't always need Kegels, because if you're already stuck on floor 2 and all you do is contract 2 to 3, 2 to 3, but you're just gonna get tighter and tighter. You always gotta relax and lengthen and give those muscles a stretch. So to do a pelvic floor contraction, you're always thinking about all of these pelvic floor muscles. So it's really easy to think about this middle space, which is called the perineum, and doing your contractions from there. If you think about just contracting your vagina, all of the pelvic floor muscles will contract. If you think about squeezing just your rectum, all the pelvic floor muscles will contract. You just get them a little bit heavier in the front or in the back. So they do help. It is still good to do them like that and think about that. But in an ideal world, you want to think about the middle and squeezing the whole thing equally. So for a contraction, you're gonna think about trying to squeeze those muscles to avoid passing gas, to hold in a bowel movement, to hold in your pee. There's also this analogy of like picking up a blueberry. So can you squeeze your muscles as if you're trying to pick something up? If you're a man, you're gonna think about, okay, I'm gonna walk into cold water and do a little bit of a lift to kind of prevent it from going into the cold water. So things like that. So with those contractions, you're trying to think about squeezing and lifting everything. Then you're gonna relax, and then you're gonna try the lengthening. And so the lengthening is more difficult for people to get, but you're trying to open up and relax those muscles. Imagine you had picked up that blueberry and you're trying to relax and drop it. Relax to have a bowel movement, relax to pee, open up those pelvic floor muscles, gently lengthen them. When you do these movements, lengthen or contract, nothing else should be kicking on. Your butt shouldn't be squeezing, your thighs shouldn't be squeezing, you're not throwing this belly in and out. It's just the pelvic floor muscles. If you were doing them right now, I wouldn't be able to tell. And then you want to think about, again, lengthening them and then contracting them. And so every time you do a contraction, you're going to relax and lengthen them again. You always want to make sure you're relaxing and stretching them. And then after you do the pelvic floor, oh sorry, I skipped. Step 2 is coordination. That's the whole idea that you're going to inhale and lengthen, exhale and squeeze. So throughout your day, you're always working on that coordination, so that way as you go to do something hard, like open a door or lift up your groceries, we have trained you to exhale on that part, which means all your muscles are going to strengthen and contract and support you. And then you're better able to control something like a cough or a sneeze, which is a big exhale, because your muscles are contracting and supporting you. So we've got the lengthen, the coordination, and then really kind of the strengthening aspect of things, which again is hips and backs and everything. Again, these exercises on here are not ones that you have to do. They're just examples. Don't get worried. And yeah, I think that's it. And then the last slide is just my information, and that the idea that if you need a referral, you would just call your PCP or your urologist if you see one, have them send it over to UMass, and then they just have to schedule with me. Questions, anything at all?
What do we ask for when we ask for a referral? What do we tell the doctor? We want to
Pelvic
refer.
floor PT,
Pelvic what?
pelvic floor physical therapy. Yep,
Okay. Thank you.
you're welcome.
I'll be seeing you.
Perfect, okay, I'll see you then, it's a date. And I have handouts up here that have those I love you massages and just kind of like the homework that you can try and the habits, and then some of the exercises that you might be able to do too. So feel free to grab some of those before you leave too.
Thank you.
Thank you, everyone.
A lot of information in a short period of time. Like my brain's
I was full of when she got the ball brought up like this. How long does it take to get an appointment with you? Are you really booked way out? Most doctors are booked out till July.
Yes, I'm not as bad as them. I think right now my earliest appointment is March 3rd, so it's 5 weeks.
I'm going to Florida tomorrow, so I'll.
Take her with you.
Yeah,
That's
get me when you come back. Yeah, that is the tricky part, but it's not as long as some doctors.
oh. Even getting into regular PT takes a while,
Yeah,
but
I
that's
know.
a great place where you
Yes,
work.
and there's one other woman who does pelvic floor PT in Charlton. She's only there on Mondays though, so I'm really kind of like the only one who's there. So there's a lot of people who need it, so it gets really bad, really packed,
Never knew
which is a
about
good
it.
problem to have. I know it should be. I don't know why.
Why the doctors don't refer you, I mean,
I know. I could tangent on this for hours. I don't understand why. It doesn't make any sense.
can you, this is out of the, can you say, why do we get UTIs?
So UTIs can happen for a couple different reasons. So, yeah. So sometimes it's because you're holding your urine for too long. Sometimes it's that you're not emptying fully. So there's some that gets held in. You're not flushing out the system with water. So it can happen for a couple different reasons. Frequent recurrent UTIs can have a pelvic floor component, because if those muscles are really tight, then you might not fully release everything, and then a little urine gets
I'm
trapped.
subject to them.
Yeah. So it can be that. It also can just be pH and other difficult things like that. But yeah,
What was the last?
pH.
pH balance,
Oh,
like
yeah.
vaginal
I should
pH.
drink more water.
Should drink more
I
water.
drink 2 bottles a day. I put them on the counter and that's how I know how much I drank.
Yeah. So you just need half your body weight in ounces of water.
But I like the way you said about the habit,
Mm-hmm.
because it is true. I
Yeah.
do wake up every night at 1 o'clock.
Yeah.
Even if I went at 11 o'clock before I went to bed. And I wake
Exactly.
up at 5 o'clock. 1
Right.
and 5.
Right.
Every
In those
night.
situations, it's like, well, did I not pee? You know, if I'm having the urgency, right, did I not pee for a while? Well, then maybe I have to go to the bathroom. Have I just drank a ton of water? Well, then maybe I have to go to the bathroom. If the answers are no, then chances are you don't have to go to the bathroom. And the other important thing too is I didn't talk about it, but chugging of water. So when you drink water, you actually should sip it throughout the day. If you chug it, yeah, so people do that to make up for not drinking water throughout the day. What happens though is your kidneys can only process so much, so it will just get rid of a lot of it and will make you have to pee more. So you should always try to sip. Yeah, that's an important thing.
I have paperwork.